Associate Professor at the School of Public Health at the University of Technology, Dr. Alverston Bailey, is suggesting that the Ministry of Health explore the mix and match concept of the COVID-19 vaccine. He contends this is critical at a time when supplies of the vaccine are low. Shamela Pullen reports.
8 weeks or 12 weeks, there's been much debate over when is the right time for persons to receive the second dose of the COVID vaccine. The Ministry of Health says Jamaicans have up to 12 weeks, although originally advising that the interval between the first and second dose is between 6 to 8 weeks. Weighing in, Associate Professor at the School of Public Health at the University of Technology, Dr. Alverston Bailey argues that persons have up to 16 weeks. After that, one may have to start the process all over again.
The first dose of the vaccine will give you about 70% efficacy. The second dose will give you 95%. The experts have advised that the ideal time to get the second dose is week 8 to 12. But in some instances, this could be extended to 16 weeks. I think after 16 weeks, the persons who have been vaccinated should consider perhaps starting the whole process all over.
Dr. Bailey is suggesting that the government consider a concept called mix and match. This means they can mix the AstraZeneca with another type of vaccine like Pfizer or Moderna. Dr. Bailey says other countries have been using it and so far it has worked.
The concept of mix and match was explored in Europe because they had a lot of vaccine hesitant persons who did not want to take the second dose of AstraZeneca. So trials have been conducted in Spain and in UK to look at adding the Pfizer-BioNTech vaccine in particular to the AstraZeneca, and the results have been remarkable. The response to the Pfizer-Moderna shot with AstraZeneca has been extremely successful and can now be used.
Dr. Bailey also thinks the government should ramp up vaccine diplomacy by engaging other countries outside of those they're in consultations with. In the meantime, Dr. Bailey is reiterating that the government review its vaccine strategy, specifically how it's managed. Shamela Pullen, TVJ News.